Hello, good afternoon from the World Health Organization headquarters in Geneva. It's a Wednesday around 5 p.m. Local time. We apologize for a little bit of a delay. We had some sound issues. My name is Alexandra Kuzmanovic, and today I'm very pleased to be joined by Jana Diaz, our COVID-19 clinical lead, and Özge Tunçalp, who is our maternal and perinatal health expert. So today we're focusing on answering your questions about pregnancy and childbirth during COVID-19. So if you're watching us on Twitter, please ask your questions by using the hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, please leave your questions via comments section. Janet, Özge, good afternoon. Thank you for your time and for being with us today.
Good afternoon.
Good afternoon. Thanks for having us.
So before we receive the first questions from viewers, maybe we can start with explaining how expecting mothers can stay safe from this virus, and in general how to stay safe, as pandemic is by itself stressful time. So we are sure that it is more even stressful for new moms to be on how to protect themselves and their babies.
You're absolutely right, Alex. And at this point, pregnant women should take the same precautions to avoid COVID-19 infection as other people. And I just want to highlight some of the things you can help protect yourself by wearing a mask, cleaning your hands, keeping physical distance, opening windows as much as possible when indoors, and practicing respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze, and then disposing the tissue immediately. However, at the same time, this is a very important point in your life. This is you're pregnant, you're expecting a new baby, and during this stressful time, it's very important to follow the routine care appointments, antenatal care, during pregnancy or after birth, postnatal care, getting the vaccinations recommended by your healthcare provider, keeping a healthy diet and exercise during this period to stay as healthy as possible, and like you said, in this very stressful times.
Thank you so much. And Özge, do we know if pregnant women are at higher risk of getting COVID-19 infection and maybe severe disease?
This is a very important area that we have been reviewing and synthesizing evidence on a continuous basis. And right now, there is no evidence that pregnant women are at higher risk of getting COVID-19. What we do know is when they do get COVID-19 and when it's severe, we see higher rates of admission to intensive care units compared to non-pregnant women. Therefore, it's very critical that pregnant women, those around them, and all of us take the necessary precautions against COVID-19 transmission.
Thank you. Thank you, Özge, so much. Janet, maybe you can tell us more from your expertise as a clinical care lead. What happens if a pregnant woman gets a severe COVID-19? Is there any difference in how we are treating pregnant women? And also, are the treatments that we have currently in place corticosteroids and oxygen for severe patients? Do they pose any risk for a baby?
Thanks for that important question. The main thing to understand is that we need to give the pregnant women who have COVID-19 the same attention and care as patients who are not pregnant. So if a pregnant woman develops severe or critical COVID-19, then they would get the same treatments. And so what has been proven to be life-saving in patients with severe and critical COVID-19 is our corticosteroids. And those can be given to pregnant women safely and should be given because they are known to reduce mortality in patients with severe COVID-19. The other interventions are supportive care interventions, so the use of oxygen therapy. So if the woman with COVID-19 has signs of respiratory distress or has a saturation level that is low, then the immediate administration of oxygen therapy is indicated and is safe and will also reduce mortality. So when combined, that's the package we have. And then all the other good supportive care interventions that are done in the hospital and may be done, as you heard, patients may end up in the intensive care unit. And so all the good practices for good quality supportive care, oxygen therapy should be given to pregnant women equally as we give to patients who are not pregnant.
And if I may just
Thank you
follow
so much.
up on...
Thank you, Janet. We are already receiving questions from our viewers, and here is the one coming from Laura Bahena watching us on Facebook. Question: what are we recommending for a positive COVID-19 mom to do while there is a COVID-19 negative baby? What are the different practices among the countries, or there is a one recommended guidance on how to treat mothers who are positive while their babies aren't infected?
So at this point, this is a very important question. And we are currently recommending women to keep their babies with them, continue to breastfeed, continue to stay in the same room, do skin-to-skin contact, even if they have COVID-19. And this is important because there are the risks of not doing these evidence-based interventions actually outweigh the risk of the newborn to get the virus and get sick. And in that case, we recommend all the good neonatal care, keeping the mother and baby together. But here I want to highlight the importance of continuing with infection prevention and control. There are things that we can do to reduce the risk for the baby, like wearing a mask, like making sure we keep the hygiene requirements. And the other thing that's important to highlight, for example, for wearing a mask, even if you don't have a mask, it's still important to continue to breastfeed and to continue to keep the baby together and do the skin to skin. So I think these are very important recommendations for the new mothers. And when we looked at evidence, we find no replicative virus isolated in the breast milk. So it's very unlikely that the virus will be transmitted directly through the breast milk.
Thank you so much. And last week we published the research actually that is highlighting the risks of essential healthcare services being disrupted, and including separation from moms from babies after delivery. So maybe you can tell us more about the research and the risks of disruption in services, and maybe changing some of those recommended protocols as part of prevention of spreading COVID infections in hospitals.
Yes, this is very important. There was an online questionnaire that was conducted among thousands of neonatal healthcare providers from 62 countries. And the findings show how COVID-19 has been disrupting care for small and sick newborns globally. So as I mentioned, we recommend to continue to share a room, skin-to-skin contact, continue to breastfeed. And in many countries, as was shown in this survey, we see that babies are being separated from their mothers after birth. 2/3 of healthcare workers who responded to this questionnaire would say that the kangaroo mother care, which is a life-saving technique involving early, prolonged skin-to-skin contact for preterm babies and exclusive breastfeeding, were not being done. And also that was for mothers having a positive or unknown COVID-19 test status. And this is especially crucial for preterm babies who are especially in need of this kind of care to be able to survive. So looking at this data, another analysis that was conducted was, what are the lives saved if we were able to keep these recommendations and have the mother and baby together after birth? And it showed that 125,000 lives could be saved with full coverage of kangaroo mother care across 127 countries. And like I was saying, it's risk and benefit analysis. And if you look at the risk of newborns catching COVID-19, that would result fewer than 2,000 deaths. And it's even reduced further with appropriate infection prevention and control precautions.
Thank you, Özge. You mentioned now that infants as well can get COVID-19. So maybe Janet, you can tell us what is the protocol if an infant gets infected? How do we treat little babies from COVID-19?
Well, I think we approach the clinical care of patients with
COVID-19 in a similar approach, which means that as soon as you have a patient or you are a patient, we do a clinical assessment, and we look at the child, an infant, or in an older person, do you have any signs of complications? What is your respiratory rate? What is the pulse oximeter? What's your oxygen level? Do you have any signs of a pneumonia? Do you have any other complication? And we do know that COVID-19 in children seems to be at large more mild disease than we can see in adults. The risk factor for severe disease is actually older age, not younger age. So, but we look, because it can still happen. So you look for complications, and if you find the complications and you treat those, for example, again, if it was a small child or an infant that developed severe disease, had respiratory distress, we treat them just like we treat them if they had a pneumonia from another cause. We'd give oxygen, and then we would give corticosteroids as well in a small child if they had severe or critical COVID-19, and then, of course, the other supportive care measures. But it's always the close monitoring, looking for the complications, but also understanding that young children or infants are not at higher risk for severe disease. Thank you.
Thank you, Janet, so much. We're receiving quite a lot new questions, and I'll read the first one coming also from Facebook. When will fathers be able to come into appointments? As I had a lot of upsetting news during pregnancy and had to deal with on my own, and it affected me mentally. So this is again related to disruption of healthcare services and not be able to have accompanying person when you go for your pregnancy checkups. So what is the WHO position, Özge?
Yes, it's very important to highlight this because health systems around the world have been under a lot of stress right now, and reproductive and sexual health services are quickly disrupted when health systems are under pressure. But the message from WHO is very clear on this. Safe and respectful pregnancy, childbirth, and postnatal services are essential to maintain. What does that mean? That means all pregnant women and their newborns, including those with confirmed or suspected COVID-19 infection, have the right to high-quality care. As recommended by WHO, it includes being treated with respect and dignity, having a companion of choice, as the question was raised in the Facebook, to be present during labor and childbirth, clear communication by maternity staff, appropriate pain relief strategies, and mobility in labor where possible, and birth position of choice for the woman. We all agree, and I think that it's critical that pregnancy happens either we are in a pandemic or not, and it's not put on pause in a pandemic, and neither are every person's fundamental human rights. So it's important that women who are pregnant or considering a pregnancy at this time know what they should expect when they are having their baby.
Thank you very much, Özge. Here is the next question of, I assume, from parents who are planning to have a baby. So their question is, if we are both in good health, can we plan to have a baby now during a pandemic?
Currently, WHO does not recommend a waiting period. It's all about planning between the partners and also discussions with your healthcare providers. And at this point, we do not have a recommendation for waiting.
Thank you. And here are questions around vaccines, whether currently approved COVID-19 vaccines are safe for pregnant women to get them.
Yes, that's another very critical question, important question. And at this point, we have very little data to assess safety of these vaccines in pregnancy. However, based on what we know about the kinds of vaccines that are available, many of them being mRNA vaccines, there is no specific reason to believe that there would be safety concerns from vaccination for pregnant women. So based on this, those pregnant women who are at high risk of exposure to SARS-CoV-2, for example, healthcare workers, or who have complications or comorbidities, for example, diabetes or hypertension, which add to their risk of severe disease if they were to contract the COVID, then they may be vaccinated if they choose to do so. And again, in consultation with their healthcare provider to make an informed decision about this. So this recommendation, or what I'm saying, applies to all the vaccines right now recommended by WHO, Janssen, AstraZeneca, Pfizer, BioNTech, and Moderna. And this is another area where we are keeping the tabs on the new evidence as it emerges, so that we continue to review the recommendations from WHO, and we make sure that they are transparently communicated.
Thank you so much, Özge. And we've talked about how to stay safe during pregnancy, but then another moment for pregnant women that is stressful, and the pandemic gives another layer of stress, is to prepare for a delivery. So what are the services and the care that women should be able to get during delivery to make their delivery safe? And are there any extra precautions in terms of also infection prevention and control during the delivery to prevent COVID-19 infection?
Yes, this is a good question, and I think the one message that I'd like to highlight is that the safety is very, very important, and so is getting respectful care. And I think this is something that women and their families should be continuously able to expect from the systems when they are there to be able to give birth. So again, I want to highlight this message because I think it's very, very important that all pregnant women and their newborns have a right to high quality care during and after childbirth, which also includes mental health care. And there are things, again, that we can do, infection prevention and control precautions, to be able to make it as safe as possible, not only for the women and their companions, but also for the healthcare providers. So a couple of things I'd like to highlight. Use of masks in healthcare facilities. So women and companions should follow local protocols and other infection prevention and control measures like hand hygiene and respiratory hygiene. And WHO currently recommends universal masking in healthcare facilities in areas with community or cluster transmission, and healthcare providers should wear masks all the time for any activity, care of COVID-19 or non-COVID-19 women, and in any common area like cafeterias and staff rooms. There's also another thing for visitors, outpatients, and service providers to be able to wear a mask at all times as well, to reduce the risk of transmission. And women who have tested positive can also wear a mask while breastfeeding and caring for their baby to reduce the risk of transmission as well. So these are a number of things that we can do to make the area safe, not only for the women and their families, but also for the providers.
Thank you, Özge. And again, this is another time that you're mentioning that it's safe for moms to breastfeed their babies, even if they are infected with COVID. So can you tell to our viewers and explain, do we know whether it's possible to transmit COVID-19 from mom to a baby through breastfeeding?
So currently, we have not found any virus in the breast milk. So it's very, very unlikely for the virus to be transmitted directly through the breast milk. So that's one thing. However, when you are in close contact with the baby, of course, there's a chance of transmission that could happen during this period. So that's why it's very important to follow the same infection prevention and control measures while you are breastfeeding the baby. And again, like I mentioned, some of the research, the consequences of not breastfeeding or separation of mother and baby outweigh the risk of baby to be infected, which is very, like Janet, my colleague, was mentioning, very few, and also very kind of different kind of clinical symptomatology when it comes to newborns, very light in terms of the symptomatology.
Thank you, Özge. Thank you so much. Janet, you've been working as well a lot on long COVID. So maybe you can update us as well. What do we know so far about long COVID and what are the effects? How do we treat long COVID patients? Are there any rehab services available somewhere around the world for patients who are suffering from long COVID?
Thanks for that question. I think that's an overarching question
for patients that have had COVID-19. There are more and more research reports showing that this long COVID, or as WHO has also called it, post-COVID-19 condition, is occurring. There's still a lot to learn, however, about the complete characterization as well as the etiology of what this is, condition is. We do know that some patients, not all patients, but we don't actually know the actual real prevalence. Persons affected can have prolonged symptoms, so symptoms that are lasting past the acute phase into months after the acute phase, reported up to 6 months, 9 months. These symptoms may come and go, or the symptoms may actually happen even after the acute phase. So it's persistent new symptoms or waxing and waning symptoms. And the common symptoms that have been reported are fatigue, so a sense of fatigue, some cognitive dysfunction. Some people have described it as brain fog, and then the third being post-exertional malaise, but as well as other symptoms such as shortness of breath or heart palpitations, or neurological symptoms such as tingling, trouble sleeping, so anxiety, depression. So there is quite a list of symptoms that people have described in this post-COVID-19 condition, or long COVID. So I think the first thing is to recognize this, is to recognize in your patients or in yourself, if you've had COVID-19, have I gotten better, after a month or after 2 months? Am I feeling back to normal, or am I still having some sort of symptoms? And if you are, then you should consult with your healthcare provider. The health system needs to be ready to care for you. And the care will depend on what kind of symptoms you have and what kind of self-care or rehab interventions may be appropriate based on the symptoms that you have, or any other functional limitations you may have. So good rehab care, mental health services as well. If you have palpitations, it may be that you need to see a specialist, like a cardiologist. If you have trouble breathing or shortness of breath that hasn't improved, then you may need to go see a specialist in respiratory medicine. So what we are recommending from WHO is that recognize, so assess yourself assess yourself for the symptoms that may not be getting better, and then talk with your healthcare provider, and that the health systems be able to provide comprehensive multidisciplinary care, in a sense, right? Because the symptoms are a little bit heterogeneous. They're not just in one body system. They're in potentially multiple systems. So I think it's multidisciplinary. It's coordinated care too. We don't want uncoordinated care, so that the patient can get a holistic approach. And that also includes social services, social work services, as well as mental health services, like I already described. We do need to understand better what is the pathophysiology. So what is the mechanism? What is the etiology? Is it an immune response? Is it an inflammatory response? Is it so there's a lot of unknowns. So doing targeted treatment yet is difficult. We don't know what therapy works for post-COVID condition, or what therapy reduces or prevents it from happening. I think there's still a lot to understand about about the why people are getting this condition. But in the interim, more research is needed, rehab interventions, multidisciplinary care, holistic care, and recognition of this condition is important.
Thank you, Janet. If a mom is having a new mom is having the long COVID, are there any
mechanisms of support that we are advising countries to put in place so that they can support moms to take care of their babies if they are suffering from some of those long COVID symptoms that you just described?
It's a good question, and I think it goes back to the multidisciplinary care, to a holistic approach that needs to be available for all people who have had COVID-19 and experienced prolonged or persistent or new symptoms. And if you're a new mom, then I think again the system needs to be able to take care of. We have I haven't seen, and that since we need more research to understand, but we have not seen that pregnant women necessarily who've had COVID-19 are at higher risk for having long COVID. But I do think we need to better understand of who's more at risk for this. But like any other patient who's had COVID-19, we have to provide patient-centered care, assess for the person that their symptoms resolve, and whatever symptoms are persistent or maintain whatever functional limitations that the coordinated multidisciplinary care with appropriate specialists that will depend on the symptom are activated and participate in the care of that person.
Thank you, Janet. We are also receiving some comments from some women who became moms recently and who haven't been able to receive any support, and that they had to go back and forth several times to hospital on their own, so that they felt really lonely and in a way with no support from the system, especially given the lockdowns that many countries are going through. So Oscar, do we have any recommendations on how to support new moms with mental health services, as this can be, in addition, new period in life, new responsibilities, new roles, and especially fear for yourself and your baby. And if you don't have support on top of that, how the healthcare system should support new moms?
I think first of all, we have to recognize that feeling additional stress, anxiety, and loneliness in this period is normal, and you are not alone. So it's very important, like you mentioned, to reach out not only to healthcare providers in person, and when not possible through telemedicine, phone, or digital platforms, but also to support groups in your area. Many of the, for example, antenatal groups or antenatal classes have been moved to digital platforms and continue to provide a source of information and support. The same thing applies for the postnatal mom groups, for example. And like Janet was mentioning, the system is right now trying to really find ways to support women in multidisciplinary ways, which includes mental health, and which is a very important component. And some other things that might seem very common sense, but still might help. For example, different strategies that could help you deal with stress: talking to people that you trust regularly by phone or social media if you cannot meet them in person. Try to exercise as much as possible. Lessen the time that you're spending reading or listening to news that stress you during these periods. Spend time with other children that you might have, other family members. Trying to keep regular routines and schedules if you can, including time to eat and sleep, and taking one day at a time. And it's not easy, and you're not alone.
Thank you, Ozgi, so much. Janet, you were talking if a mother or if an infant gets sick with COVID-19, we treat all severe patients with the same tools we have at disposal at this moment. So maybe you can remind our viewers what are the treatments we have at the moment to treat COVID-19 patients.
Thanks for that question. So I think the most important thing is the COVID care pathway, which means that if you are a person who has COVID-19, that you call your healthcare provider. You get in touch with the healthcare system, you get diagnosed quickly, and in that healthcare encounter, either be it remote or be it in person, it is important to look for signs of any complications or signs of severe disease. That's what we call as kind of the assessment, the initial clinical assessment. And that should happen for all patients that get infected with SARS-CoV-2 and develop COVID-19. By and large, like I described before, the disease seems more mild in younger and smaller children and younger patients, and the described risk factors for severe disease are older age and the presence of chronic conditions such as diabetes and hypertension, and that those chronic conditions can occur in adults, but it also can occur in adolescents, so that would place them at risk, and in children. So if someone had those conditions, that would also be at risk, and as well as pregnant women if they also had that chronic condition like diabetes. So the important thing is to assess if there's any complications that would put you into a severe or critical category, means increased respiratory distress, signs of severe pneumonia, low oxygen levels. If that was happening, those signs were occurring, then a clinician would treat you appropriately with corticosteroids, which is life-saving in patients with severe and critical COVID-19, and as well as with supportive care interventions, of which the number one is oxygen therapy first, to improve the outcomes. So right now, that's what we have at our disposal. There's multiple clinical trials ongoing. So there's real important research that's happening around the world. And just to acknowledge all those great investigators, the big platform trial are looking at different types of therapeutics, both novel agents as well as repurposed agents. To this date, unfortunately, we don't have other agents to say that in our toolbox, but we do hope that soon we will. We are looking always at the literature, at the results of these studies to see what else can we put into the toolbox to manage patients with COVID-19, especially what can we put into the toolbox for mild COVID-19. So the majority of patients who develop just mild disease, and is there something out there that we can do to treat those patients to prevent them from getting severe disease or reduce transmission?
Thank you, Janet. And so far, in terms of treatments that we have that have proven to treat COVID-19 are corticosteroids, dexamethasone, and oxygen. Some people were asking us as well about ivermectin as a treatment for COVID-19. What is WHO position on that particular medicine?
Good question. So we have just completed our guideline development meeting. So that means WHO, as many of you know, we assemble expert panels to look at the evidence, which is the results of all the studies in a synthesized way. And so we held that meeting just a couple of weeks ago, and our recommendations are nearly finished. So by early next week, we should have our recommendations of ivermectin. What I can say right now, before that publication, is that that there is, although multiple studies happening on ivermectin around the world, many of the studies are very small. So the studies are small in nature, and so the number of events or outcomes are low in number. And so with that, we've looked at all the evidence, and I think by early next week we'll have the formal WHO recommendation to share publicly.
Thank you, Janet, very much. Before we close,
I would like maybe to invite Özge once again to remind our viewers, those who are pregnant at the moment, on how to stay safe from COVID-19 and to actually have a healthy pregnancy during this stressful and extraordinary time we all live in.
Absolutely. There are things that we can do to avoid COVID-19 infection, like the infection prevention and control precautions. And I can't stress this enough in terms of how important they are for us to follow, and not only for the pregnant woman, but everyone around the pregnant woman as well, from wearing a mask, cleaning your hands, keeping physical distance, opening windows as much as possible, and practicing respiratory hygiene. And another thing that I want to highlight here is, please do follow your routine care appointments during pregnancy and after birth. It's very important for you to be able to get the care that you need as you are getting ready for childbirth, during pregnancy, from vaccinations, from certain tests, to make sure that your pregnancy is progressing safely for you and for your baby, and to things like keeping a healthy diet and exercise. And when it comes to childbirth, please know your rights, that you deserve a quality care during childbirth, that you deserve safe and respectful care. So please make sure that you are aware of what is the evidence-based recommendations and what you should be expecting when you go to the facilities or to have your childbirth. So it's very important in terms of having a companion of choice, in terms of having respectful and dignified care, in terms of being able to communicate during this very important point in your life, to be able to have a positive experience, so that it's not only safe, but it's a moment, even in these times, for something for you to remember, for you and your partner and your family to remember. So I think these are the things while we have in our disposal the infection prevention and control precautions and the toolkits. So I think this is very important to use this. And while we continue to have mothers and babies together after birth, continuing breastfeeding, continuing skin-to-skin contact, staying in the same room, regardless of their COVID-19 status.
Thank you, Ozge, very much. And once again, if you could please repeat, what is the WHO position, whether pregnant women should get vaccinated against COVID-19? Is it safe for them to get vaccinated?
Right now, it is. There's very little information, but WHO, as WHO, we don't see any safety issues with the current vaccines that are out there. So for women who are at increased exposure to SARS-CoV-19, like healthcare providers, or a woman with comorbidities like hypertension, diabetes, which put them at higher risk for getting a severe COVID if they were to be infected, we do recommend them to make an informed decision if they choose to do so with their healthcare providers and get the vaccine.
Thank you so much. Thank you both for your time and for answering the questions on this very important subject. I would like to say thank you to our viewers from Yemen, Algeria, Indonesia, Thailand, India, Bangladesh, Myanmar, the US, Canada, Italy, France, Netherlands, Germany, Switzerland, France, Morocco, UAE, Qatar, Spain, Argentina, Australia, Mexico, UK, Brazil, Cameroon, Nigeria, and many others for watching us, for asking your questions. If you missed some parts of the conversation, you can find more information on this subject on our website, or to follow regularly our social media. And as Janet mentioned, there will be some new recommendations on clinical care coming next week. Until then, please stay safe. Thank you.
Thank you.
Thank you.